We have already been dealing with a pandemic, and now we're entering flu season. So what happens when the two mix? We'd like to get some important answers from Dr. Jody Lenko, who is the Vice Chair for the Department of Medicine for Lehigh Valley Hospital in Hazleton. Dr. Lenko, thank you so much for joining us today. It's a pleasure.
Oh, thank you for having me. It's a pleasure is mine.
Now, how do we start with this? How are you concerned that people will be more concerned over the pandemic that we've been dealing with, that they'll kind of forget about flu season this year? What do you think?
Well, we certainly hope not. And we've been pretty aggressive in our office in terms of making sure that everyone is aware of the flu, aware of that this is the time of year to get your flu vaccine. So we've been vigorously giving our patients in my office and in our health network the flu vaccine starting in October. So now more than ever, it's important to be aware because as we know, flu and COVID symptoms can overlap and are very similar. So this is a very important time to think about getting your flu vaccine now, even though it is a little bit early for the flu season.
You said that those symptoms kind of overlap. So tell us, what mainly are the differences and what are the similarities between the flu and COVID?
So yeah, it is very tricky to kind of sort out what is what because both viruses are they can be almost identical. They both cause fever, aches, fatigue, muscle aches, headache, and cough. Those are the main symptoms of both of them. In general, sometimes it's hard to tell, but sometimes the flu starts with a cough a little bit earlier. Sometimes COVID starts with the fever and the aches earlier, but again, it's very difficult to tell. So we always ask that if you're at all concerned about either one of those, that you contact your healthcare provider right away.
Who should be receiving the flu shot this year?
Sure. So anybody over the age of 6 months, we recommend that anybody get the flu vaccine this year. And it's especially important for our older population, specifically over 65, and also anybody with chronic health conditions like diabetes or heart problems or cancer. And specifically for our older population, there is a special dose of the vaccine that we call the flu-ad vaccine. That is a higher dose vaccine that is specifically designed for our older population over 65. So we do highly recommend that special vaccine for that population.
We've all heard that some people say, I got the flu shot and then I got the flu. So some people kind of tie it together. But if you do get the flu shot and get the flu, is it that you get a milder version because you've been vaccinated?
So yeah, most people that say they got the flu shot and shortly after they got sick is either coincidence or the fact that some people develop a syndrome, like a mild flu-like symptoms after they get the flu shot. And that is simply your body's making its own immunity. So that's actually somewhat of a good sign if you do feel a little tired, run down, maybe even a low-grade fever after you receive your flu vaccine. It's not the true flu. The flu shot cannot give you the flu. But like you said, there is a chance that the flu vaccine is not going to be effective. But what we found, and this is research has been shown this over and over again, if you do get the flu vaccine and you happen to catch the flu, you will get a much milder case of the flu and you are less likely to die from the flu because you had your flu vaccine. So I think that's important to note.
Great advice. I hope you have a mild cold and COVID season this year and that we get all through this safely.
Thank you. You as well.
Today's news feature is brought to you by Workforce Resources Inc. of Hazleton, in business since 2013, located in West Hazleton. If you're looking for a job, call them at 570-454-8810 and find out how you can apply for specific jobs, including skilled positions and warehousing. Full-time and part-time opportunities are available.